Very good. Welcome to everyone. We're so excited to have an opportunity to talk to you about one of these tabletop simulations that we use often in our curriculum. I am privileged to be presenting with my colleague, Dr. Jennifer Alderman, and she and I have done a lot of work with Friday Night at the ER at the University of North Carolina at Chapel Hill in the School of Nursing, and also with our interprofessional learners. Friday Night at the ER is a way for us to really develop systems thinking and learning using a tabletop simulation. And the thing that's really nice about this is you have an upfront cost, but after that, it is really low maintenance because it is a product that's durable and usable over time after time. So this is just to introduce us as presenters, and we teach in the undergraduate and graduate program and use this product in both. And we're going to talk a little bit more about that in just a little bit. Our learning objectives for this hour is really to look at utilizing this tabletop simulation to move from individual patient to systems thinking. And also you're utilizing serious gaming to assist learners to consider their teamwork, communication, and collaboration, and also to help us to understand our implicit biases. It's really hard to get to those because of the very fact that they are implicit. But in the reflection in this game, you really do begin to uncover where your biases lie. So I'm going to turn it over to Jennifer to talk a few minutes about the overview of our use of this program.
So when considering how Friday Night at the ER can be a useful product, incorporated into educational or clinical settings, really both areas, it's very applicable and very useful. We need to have some underlying principles kind of understood about Friday Night at the ER, which I think all of us can see how all of these bullet points here are very valid. So we know that system failures occur very frequently in our country, in our US healthcare system, and oftentimes there are system failures that contribute to many, many adverse events and medical or healthcare errors. And so there's this idea of systems thinking. And of course, you can see the definition here on the slide, but essentially, systems thinking means that we are not in silos, we are not in isolation. Everything that we do impacts the whole, so the parts impact the whole. So if you think about, for example, a root cause analysis, maybe some of you have participated in those or certainly have an understanding of how those work. But if you think about an adverse event and then a root cause analysis is done related to that adverse event, that whole system or process is kind of picked apart and everything is looked at as to determine what contributed to the adverse outcome. So systems thinking is really that ability to recognize, understand, and synthesize how all of these processes work together and that we're not working in silos when we're providing care for our patients. Most health professions education programs do not really include these immersive experiences for learners that really allow them to explore and examine their implicit biases and to look at what behaviors actually impact those patient outcomes. So again, systems thinking is fundamental to QI efforts and has been suggested as a key element in improving patient safety. I think we can understand that, with patient safety, of course, the number one reason for healthcare errors is ineffective communication. And Friday Night at the ER really allows learners to examine how they communicate, within, in a silo and then across departments in a healthcare organization. And of course, research has demonstrated a relationship between systems thinking and safety practices, because we all understand that many of us have seen James Reason's Swiss cheese model. So this is in effect the idea that all of the holes in the Swiss cheese line up, contributing to an error, an adverse outcome. And that is essentially what systems thinking is in a nutshell, understanding where all those holes are so that you can kind of pull back and see the system and not just in a silo. So essentially, Friday Night at the ER allows healthcare education to offer this systems learning opportunity. And again, we don't typically include meaningful learning around systems thinking. And that way of thinking is really critical to improving organizational outcomes. So we as educators are challenged to broaden healthcare practitioners, whether students or folks already working in the clinical setting, to really think about their whole entire spectrum of care through a systems lens. And ultimately, that impacts quality and cost. And Friday Night at the ER does a really nice job of having those participants look at how their decisions ultimately impact quality and cost in the system.
So I'm going to talk just a little bit about some of the histories and the use of Friday Night at the ER to give you a brief example of that. It's used in leadership development and quality improvement, as Jennifer's already talked about, and also how can we change our cultures and understand how we're working together and how we can actually improve that. Used in team development and strategic planning. One of our colleagues uses it with all of her nurse managers, and she runs them through the game periodically, not just once and done, trying to help them think about strategically improving processes. There's also this ability of raising awareness of metric performance improvement. Oftentimes our students are so focused on learning how to be a nurse or a physician or a pharmacist, they don't realize there's metric performances out there that they are going to be measured on as a unit or a hospital. It also looks at community services coordination, disaster response, undergraduate education, graduate, interprofessional, and orientation. Many, many ways to use it. The history of it is that it was developed in 1992 by Beck Gardner, a systems thinker and also management consultant, and she revised it in 2014. It was inspired actually by a hospital case, and it was designed to engage teams experientially to learn how to apply systems thinking in their work. So it's used broadly by groups at all levels. Over 1,000 companies in 35 countries with varied cultures have used it for these kinds of things, including many non-healthcare companies have used it because it really is looking at systems. And the reason it's situated in a hospital is most people have a point of reference about hospital. They either know a hospital, been in a hospital, someone they know have been in a hospital. So it makes sense to them to situate it here, but it's not healthcare centric. So this is a picture of the game board, and the game board with its pieces here. I'm just going to talk to you a little bit about this, but then I'm going to move on and talk about the game play. But you'll see that the hospital has been shrunk down to 4 units, and you're actually going to play the game in a 24-hour simulated time frame, which means that you'll go through 24 hours in the hospital. There are events that occur, there's different things that happen, patients come in and go, you make decisions as a team, and then you actually get a chance to debrief it and reflect upon it and apply those to looking at what happens. The idea is that this gameplay takes anywhere from 1 to 3 hours, including the time you start to the time that you finish the debriefing. But the simulated hours move you through a realistic Friday night at the emergency room. Things start out slow, they accelerate as the night moves on, and then you get to Saturday morning. Each hour, the participants have to look at how many people are arriving, whether walk-ins or by ambulances. They have to make decisions about exits of their patients, if they're going to be open or closed, and do they need extra staff or not. And paperwork, of course, is done after every hour. This begins to help the learners understand that there are the metrics that are going to be measured, and this paperwork adds to the outcome of their performance on the quality measures and the cost measures. So you can see people playing here and things, and they are a pod of students or learners or practitioners, and we've used it in all of those places. And they get to name their hospital, and patients come in and out as they move through the gameplay. So I'm going to walk you through a little bit of that. I really think is helpful for you to understand the game board a little bit better. You can see there's a little flip chart on the right-hand side, and this is turned at every moment in time as they move through the hour. So a table can move as fast as they want to, as slow as they want to, but if they don't finish the game, they actually get a penalty if all the other teams have completed it already. So there's 3 core strategies that we're trying to drive home here: collaboration, innovation, and data-driven decisions. That's the overarching concepts that are trying to be delivered. So you see here that patients are coming in right here by ambulance in the emergency room, and the emergency room gets busy pretty quickly on a Friday night. They have walk-ins, and they got patients in the waiting room, and they have patients waiting and ready to be transferred, as well as patients who are matched with one staff member and one patient. And that is the only rule of the game, that there has to be a patient, a staff member and a patient at all times partnered together. One of the issues that's really important about that is that staff member is not necessarily a nurse. It is all the pieces of all the people caring. So it's like a healthcare team member who is actually the ones who are providing the care. So then the other thing is there will be requests. You see there's green dots here indicating that these people are ready to be transferred into care, and the request cards have gone out to different units for that purpose. You can also make decisions about, I'm full, I'm going to divert ambulances. And then the units, you can see that surgery here also has people ready for transfer with a request, but they also have patients, some empty rooms that are here that they could receive other patients. And then next is critical care. It looks like they're pretty full, but it looks like they have 3 empty rooms. And then the last thing is no beds. They can choose to close or open. Now, interestingly, about 8 p.m., the step-down unit closes until 6 a.m. And so students are like, that's really cumbersome. That's really not quite fair. But in reality, you don't actually call someone up at 3 a.m. to say, come get your grandmother because we need the bed. It really does, discharges usually do start around 6 a.m. All right, so now, as we look at this and move on to the next thing, one of the things is that students will or will not ask about data, meaning how am I going to be measured? And you can see here that if you do ambulance diversions or patients waiting, or that's more expensive than using extra staff. So the data can affect the decisions. So if you look at this board, it looks a lot different than the last one. You can see here that it's a little bit more organized in the way that it's being delivered. Step-down unit has been totally maximized. They got 2 patients in every room and a staff member with them. Sorry. And then they also have in the waiting room, they actually are treating patients in the emergency room in the hallway. What that means is that we have a whole lot less requests waiting, and we have less people waiting to get into care, which will increase your quality measure in a positive way. So now as we look at this, we have even out here in the hallway, they're taking care of patients. So at a certain time in the gameplay, an event occurs. And this is an event for everybody, but the events are different for different units. And so the team has to pause a minute here and think a little bit about how we're going to manage this. And so I'm going to give you a minute to look at all these different events, and also pause a moment to see if there are any questions that can be added in the chat, or you can unmute and ask, because we do have a small group, and that will make it easy for us to have interaction. So these events really do mirror clinical practice. And they are the kind of things that we have to navigate. And this gives the learners an opportunity to even consider what is happening here. At the end of the gameplay, the teams calculate their scores on quality and cost. They graph it for their performance, and then they post it. And this information is used in the debrief. So there are kind of 2 sheets there, one for everybody to enter their data, and then calculations are made. And this is where if you didn't finish the gameplay in the allotted time, you have a penalty that affects your score. And then they actually graph their score at this point. The thing that we have found that has been most fascinating about this is students get really immersed in this. And even before you can even finish giving them the instructions, they're ready to dive in. I know the first time that I played Friday Night at the ER, I was very siloed in my play. I was very committed to doing a great job in taking care of my patients and my staff in my unit. And you hear there that word, my. Instead of me thinking about it as a system, that this was all of us here. And so in the debrief, it became very evident that that mentality is not what will get me to systems thinking or improve my performances on metrics or our performances on metrics in the hospital. At UNC, there's this sense that if a patient enters the system, they're our patient. They're not the ER's patient or, the step-down unit's patient. They're our patient. And we're working together to kind of get them into care quickly, get them the care they needed, and then to move them forward into helping them to maximize their care, their health at this point in time. So it was real shocking to me to see that I had not performed well when we got to the calculation part, because that was my intent to really, I'm very competitive in gameplay and I really wanted to win in essence. But in my siloed thinking, I had not won. And so that's one of the ahas that students have as we move through this. So in the end, they actually graph their team performance and we post them around the room, which is really a nice way for us all to see how they perform. And they get to see how they perform to others. And the lower the bar in terms of the graph, the better the metrics. So the lower the quality errors, the lower the cost is what you're targeting. So when we come to debriefing, this is a very important piece for us to be able to look at this and say, how have people performed and what is it that is happening? So we often will go to the person who has performed. You can decide how you want to do it, the worst or the best, and ask them a little bit to tell us a little bit about what they are doing, what they did. And so students will, or participants will say something along the lines of, well, we knew that diverting ambulances was more costly than using extra staff. And someone else will immediately pipe up in the room and say, how did you know that? Well, it is said in the introductory instructions, but students are so ready to start play that they actually stop listening. And then secondly, unless they ask key questions, they're not given the data card that I showed you before. And so they don't know what costs them more. So we're able then to take that back to say, as you've been in a unit, and some of these are practicing nurses, can you tell us what are the metrics by which you are being measured? And then you are able to talk a little bit more about us going in and finding out a little bit more about the metrics that matter for our unit, as well as for our hospital and the hospital system. We actually use this opportunity to tell our nursing students that we want them in their interview to talk to their employer about what are the metrics by which their unit is measured, what are their quality improvement projects that they're focused on, and how can I, as a new employee, contribute to improving those metrics. That's a whole new way for a new grad to interview. And it's because we play this game and they begin to see the difference in it. Another thing that's real powerful in this kind of reflective process is that students say, goodness, I'm not sure that I want to be a nurse manager, because they begin to see the complexity of what it is to manage patient flow, request, and worry about metrics and cost and balancing all that. And then we go on and talk to them about, so now that you understand a little bit more the complexity of a system, when you approach your nurse manager and you ask them for X, Y, or Z, you can have a better understanding of why they have to juggle many things before they can say yes or no to that. The third thing is that we push our students to be the change agent that needs to happen to improve the metrics in their unit and their hospital. And that's one of the things that's real powerful about this opportunity. So again, I'm going to stop for just a moment and just see if you want to unmute or show your video or ask a question about the gameplay at this moment in time. it is such a fun game to play. Susie, do you have a question or a thought?
I have a thought, but I don't know if it's going to disrupt your flow or not, so you can put it off the answer. But that concerned me, raised a red flag when you said it puts off students to think about management as a career path. Does that get straightened out later on?
Yes.
Okay, good.
We actually talk about it, that this awareness is really important. But this leader, being equipped to be this leader in the future is what we're trying to help them understand. And so it's just a couple of students, probably once every other gameplay, that says, oh gosh, I don't want to be a manager. But we talk about the importance of that role and how that role can actually improve the care of the patients. So we do not leave it there, Susie. Yeah, so thank you for asking that question.
Thank you.
And Shannon, I see your question. There are only 4 players at a time, but when you purchase a set of games, there are three boards, and the components of those gameplay are in the tube. So you usually buy them in sets of 3. We actually have now 18 game boards, because we want to be able to play, up to 72 students at a time. So you have the capability of putting 4 students at a table. When we have an odd person or some kind of odd numbers, we will put a second person at the emergency department, since it is the busiest place. But you don't want a bunch of people observing, because they don't have the same experience. So they do need to do gameplay. So we play 104 students, and we divide them into half in the morning, half in the afternoon, play them in 2 different rooms. We even played during COVID. We had masks and face shields and gloves and cleaning protocols in between, and the cleaning protocols is on the website, so that we could continue this kind of training in the midst of COVID, because these students were going to graduate in the midst of COVID too. You want to have someone who can facilitate the game, and then the 4 players at a table. And when you have that second person at the emergency room, you can do it one or 2 ways. They can co-decide how they're going to manage that unit, or you can have one play the first 12 hours of the 24 hours as the lead manager, and the other play the second 12 hours as the lead manager. It actually has worked quite well. And as we're doing the play, the thing that kind of makes it more realistic is, and it's in the manual that you'll receive with this, is you can switch it up a little bit. So one of the things that you can do in the middle of the gameplay is to tell them that, you're going to divert patients, and your emergency room is full, and you have to actually take your patients to the game table next to you as the next hospital. We've also inserted one that we really love, is where we say that the hospitals in the area are paying more, and so your emergency room nurse is leaving. And so we have the emergency manager get up and move to the next table and take over emergency management there. Now we have opened up the door for them to actually look at a lot of things that are about onboarding someone new. Oftentimes they would just keep playing the game, but do they take this opportunity to find out what the person knows or needs to know? Do they tell them how they've been operating? Are they willing to listen to new ideas that this person brings in from the other unit? And so this idea of a new kid on the block in the midst of your already established gameplay gives us an opportunity to reflect upon what that feels like, and also how did you integrate and learn from their best practices, and help take those to advance your own play or improve your own performance. So that's really a fun way to do that. And then the third way that we mix it up is we actually say that the CEO has required a reorganization of our units. Everybody stand up and rotate to the left. And so students are like, wait, this is not tidy enough for me to move, or thank goodness I'm getting out of this chaos and somebody else can deal with it. There's one of the 2 ways that people look at it. But there's this sense of what do we do as we change units, right? And how do we help people understand how to manage the next unit? It's kind of like a float going to one unit after another. And we can talk about that. So you can create many, many debriefable moments in the way that you actually play the game. We have actually, and Jennifer can talk about this in a little bit, about we played it more than once with the same group of students deliberately, and she'll talk about that in just a minute. Any other questions at this point? You can tell we just love this game. It is just such a thought-provoking game. It's worth the time. I had a student approach me about a week after we played, and he said, I want you to know that I'm still thinking about that gameplay. And so then we had a great conversation about, I could have lectured to you about systems thinking and you would have understood it at some level, but it's not the same kind of understanding for you to have actually been immersed in a system, be accountable for the metrics of quality and financial cost. And now all of a sudden you have a whole nother view of it. And I haven't had students come to me, and you may have, who said, I've been reflecting on that lecture you gave last week. But having students come and say, I've been reflecting on that gameplay that we had last week is a real powerful testimony to what this game does for students. So Jennifer, I'm going to let you talk a little bit more about what we've been doing with this game.
Sure, absolutely. So let me just double check. So Kathleen has asked, that just popped up, how much information do you give them in a pre-brief?
Oh, that's such a perfect question, Kathleen. There is actually a manual, and it has really detailed instructions about how to introduce the game. And so we give them that instructions. And let me just tell you, just like any other educator, probably, you look at this and you think, oh goodness, it's going to take me 20 minutes to 30 minutes to tell them how to do the gameplay. I don't want to do it that way. I'm sure I can do it better. Let me just tell you from experience, you cannot. If you follow the script of what they tell you how to tell students to play the game and ask students to hold their questions until you finish, you're in such a much better place than if you think you can do it better. Let me just tell you that's from experience. Then the second piece of that actually is in that pre-brief, Kathleen, we tell them everything they need to know, including how they're going to be measured. Again, it doesn't stick because we're listening selectively, which is another debriefing point. So the script is there. They have everything they need to know, including the metrics of measurement, and then they go into play. They will argue with you at the end that you never told them about the metrics of measurement, but that's just part of our ability to take in so much verbally. So.
So we'll talk now for a few moments about different ways we've deployed Friday Night at the ER at UNC. And at the baccalaureate level, we've deployed it in a quality improvement course and in our interprofessional teamwork and patient safety course. And most recently in what we were calling our on-campus clinical courses. And this was the example that Carol mentioned, in which we had a group in the fall of BSN students, about 100 students who participated in Friday Night at the ER for the first time in their on-campus clinical course. And they loved it so much that they wanted us to repeat it in their spring semester, which was their last semester. And these are the folks that just graduated actually with us. And so they really enjoyed it. And so this is a nice way to deploy the game if you want to do like a time 1 and a time 2, because what you can do at time 1 is, they're kind of getting their bearings with the game, having never played it before, and they really understand how to run the game by the end of that. And of course, you can have a robust debrief primarily focused around, let's look at your metrics and let's look at those graphs, that are posted up and talk about those things. But then at the time 2, we were really able to take a deeper dive in the debrief around really getting at that systems thinking even more robustly. For example, in the debriefing at time 2 with this particular group, we were able to really dig into this, what's called a force field analysis. And this comes with the Friday Night of the ER materials. They give you, the slide deck and the materials here to go with this debrief. But essentially, the students look at facilitators and barriers, what problems did they run into and why, and they really do take that systems lens, particularly if, doing it the second time as well. So that was a really nice experience we just had with that cohort who graduated. At the graduate level, we have a quality improvement and outcomes management course that is, gameplay is a staple in that course for many years. And what's really interesting at the graduate level is that many of the students who take this QI course are in our healthcare leadership and administration track, either getting a master's or a DNP. And many of these folks are already established nurse managers or even nursing directors, different levels of formal management or leaders in healthcare organizations. And they really are able to uncover some of their biases, because having even been an experienced manager myself, having played it, I thought, oh, I know how to manage throughput, but you do, as Carol mentioned, you really end up kind of wanting to protect your own territory a bit in this kind of situation. And so the debrief at the graduate level, takes a different kind of slant, because oftentimes these students do have different more formal leadership experience in healthcare organizations. And so they can really think about ways they can go back to their jobs and deploy the game, even if there's some, I know I've had students who have some interdepartmental issues around, particularly if you think of a service line of who receives patients from which units. These students have really been wanting to take this back to their organization and play the game, honestly, in their organization, so that they can bring in folks from the different departments and really help people understand each other's perspectives better in the framework of gameplay. It makes it maybe a little safer than having some of those harder conversations, right out of the gate. But this is certainly could be a stepping stone to really being able to improve relationships across units and departments. So the other piece here in clinical practice, this, it's played in the organization. I know at UNC Hospital, I know Carol mentioned this too, they have been really deploying it prior to COVID, especially obviously across the system. And they offered multiple opportunities throughout the year for staff members, managers, all levels of managers and leaders to participate and play the game, because it really does help them take a closer look at efficiencies around patient flow. I mean, how many times over the years, have we heard about the problems with ER throughput? That's always an issue that many organizations are trying to tackle. And then understanding the outcome metrics. So really having, even whether it's like bedside nurses all the way up to CEOs, really kind of understanding one another's perspectives, because that is really where a lot of the rich learning in Friday Night at the ER occurs, to really put the lens on of someone else or another department, or really look at that, again, that systems thinking approach, that what you're doing is not in a silo. If I'm backing up in the ER, there's a downstream effect of that. And what does that do to my other unit? And really, it opens people's minds up to the possibilities of how to better collaborate across units and how to be better team players as well.
I'm going to add one more thing to that. The whole idea is in the debrief, we begin to help students understand about who's responsible for the emergency room. Mm-hmm. And initially, when they sat down at the table, they were pretty confident that whoever was sitting there was responsible. But after Jennifer does a debrief about that and then asks them that question again, they begin to understand we're all responsible mm-hmm. for the emergency room.
Mm-hmm. Absolutely. So again, you can see some of these, this is a list, and certainly not exhaustive list, of essential skills that can be developed using the Friday Night of the ER system. And again, you're applying the systems thinking. Again, leadership, teamwork, critical thinking. We really want our students to be data-driven decision makers, right? And that is what healthcare organizations are doing now as well. And what is driving all of the QI work in healthcare organizations is really, what is the data telling us, and how can we improve? How will we know that we've improved? By looking at the data, pre and post intervention. Again, this business acumen, so looking at those quality and cost metrics. Friday Night at the ER, you have a tally sheet, as Carol mentioned, and you have the graph at the end, and it comes in dollars. You're really looking at dollars and seeing what really that bottom line impact is of the decisions that you have made, kind of leading that unit that you're in charge of during the game. So again, prioritization, delegation, change management, adapting to change, and having that situational awareness that is so critical. And so maybe what's going on your unit as far as admissions and discharges that you are expecting. But again, thinking of that downstream effect of another unit's admission is another unit's discharge, right? So there's this whole kind of continuum here that the students really get a better idea of how it works.
It gives us the opportunity to really dive deeper into a couple of things. And they begin to think, you know, using extra staff must be the most expensive thing I can do. And so they have this tendency to bring in staff members for a season, like an hour or two, and then send them home. Then we get to really dive into, remember, this person has left whatever they were doing, they were called in, they got their shower, they got to work, and then now you're sending them home. Are they going to come the next time you call them? So we begin to look at personnel issues and the ways that people are treated in units. And then secondly, I've played this with as few as 12, going back to Shannon's question, 12 students or learners, and then as many as 75. One of my colleagues, Jill Sanko, has played it with 200. So it's only limited by the number of boards that you have and facilitators that you can have, because you need a facilitator in every room that you deploy. And you have some helpers that you can employ to help you kind of watch and help. But the thing that you have to guard against when you have helpers helping you is they don't engage too much with the students. Like if a student says to you, can I put more than one patient in a room? You want to answer that question in a vague sense, like it's up to you, you're the manager. If you said yes, then they also look to you, well, what else can I do? And you want this solution to be bubbling up from them, and not from you as the teacher. Interestingly enough, I was doing a group of nurses, practicing nurses, and there were 75 in the room. And I had this one table that were in this kind of heated debate. And I went over to see what was happening. And one nurse was saying, she will not take my patients. She was trying to get the patients to move through the system. And the person said, I don't have any room for them. So yeah, I'm not taking them. And so this idea of not receiving patients becomes a point of discussion as well. And I asked them, did this ever happen in practice? And they said, oh yeah, it happens all the time. So then we actually got to talk about, you know, when the emergency room calls up and they say, I need patients, I need a bed, and people are saying, well, it's close to shift change, or I don't want to have a new admit. People stall, and we know that to be true. So we're sitting here, 4 people around a table, and if I say to Susie, will you take my patient, she's more likely to do it because we have somewhat of a relationship even in the gameplay. But on the phone, when I don't know who you are in the emergency room and you're asking for a bed, which is going to mean more work for me, I might be a little slower in the doing of that. So we talk about that a lot, about how we are one unit and in terms of a whole hospital, and how can we really help build relationships so that when Susie calls, I know Susie would not be asking me for a bed unless she needed a bed. And so I should do all I can to get her a bed, because I take that patient and then one more can come in out of the waiting room. So we begin to see the system flow issues. And this is a great conversation to have with students. So now, the other thing I wanted to make sure you understood is that the Friday night ER facilitated training is available. It used to be that you would have training come to your site, or you go to a site to have it, but now it's online. And actually Jennifer completed the online training and it's really well done. So I just wanted to show you a little bit about that. The course is organized into 5 modules that include the following activities. It's about 4 to 6 hours to complete it, with additional 3 to 4 hours to participate in a practice session. Videos and readings, and they're so well done, and the pace is lovely. The exercises and practices are meaningful. You get to do your own self-assessment, and you have a mentor assigned to you that checks in and answers questions, helps to guide you with what if questions that come up. So the modules are there on the right. There's 5 of them. And then you get CEUs for it, or CNEs for it, 9 of those. And in this particular time that ends July 1, you get 4 free seats with game kit purchase. So if you wanted to have 4 of your people trained as trainers for facilitators, you can get those 4 free seats if you purchase a game set. And so that's a nice little offering that's being offered by Breakthrough Learning, who is the company that runs Friday Night at the ER. We have had such positive experiences working with this vendor, and it's just been amazing to work with them. And they're prompt and quick, and they get you supplies, and so it's really nice working relationship.
Mhm.
So I wanted to stop and see if there are any questions. And in the little bit of time that we have left, I want to introduce 2 other products that Breakthrough Learning has, just because you're an educator and you may be interested. Any questions? You can pop them into the chat. The other 2 products are Causality and Metalog training tools. Causality, we used this past spring as a beta tester, and it is looking at collaborative knowledge mapping. And so we took one of the GNSH cases, which I'm going to talk to you in just a minute, and actually had them take this case where a 3-year-old child died because of medical errors, healthcare errors. And so we then had our students go in and really do this collaborative knowledge mapping about what happened, what we could do differently, and how it can be done to prevent this from happening to someone else. Their goal was to understand the system of care in which this Nora's case occurred, and broaden their thinking to find pathways to really prevent healthcare associated infections. And that's what happened to Nora. And so there are, and this is the one slide about GNSH, there are about 15 cases here around sepsis, medication errors, healthcare associated infections, and care teams. And we selected one, which was Nora's case, to have our students do. And these cases are free, the GNSH cases are, and you can go to that link for team engagement and find it. But the thing I wanted to show you is that the students began to create a map. And this was an engaging collaborative systems mapping tool. Again, it was 104 students. We had divided them into half, and then we put them into small groups in which they were to have prepared by looking at Nora's case. We'd given them some evidence-based practice about central line infections, articles to read, and then they came to do the mapping in class in breakout rooms. And so they didn't have to have any experience prior to class about this mapping. It was conceptual, not mathematical in the way it was. It was really good for energizing learners and helping to examine a case in a more difficult and deeper way. And then building consensus about what is it that might have caused this harm, and applying systems thinking to that. And then how can we improve results, right? So this is a glance at the map, and I'm going to show you a really kind of short 1.5 minutes of it. But you can actually have things that are correlated here, and you can look at how they are impacting this. So I'm going to get out of my slide deck for just a moment and show you, sorry. This is always the hard part about getting out of a slide deck. I want to show you this other thing. So there's a question in the chat, Jennifer, if you can read that to me.
Yes, absolutely. So basically, how does the student know they did not make a good decision during the game? Do other players correct and or discuss, or does the facilitator provide probing questions?
Go ahead, Jennifer.
Okay, I was just going to say it's more about what do your metrics look like at the end, and that's really kind of the proof is in the pudding, if you will. Kind of the decisions that were made led to a more costly decision, or led to, you know, an increase in adverse outcomes or errors based on the metrics that Friday Night at the ER has the students kind of track during the game with their score sheet. So it's not necessarily, they don't necessarily know they've made a poor decision, like if they've decided to call in lots of extra staff, or they decided to divert patients. You know, those decisions, they don't necessarily know during the gameplay the quality of that decision until we really take a look at the metrics at the end. And the facilitator in the debrief is where the facilitator can kind of lead and ask those probing questions as you mentioned. But the intent really is for the gameplay is just to kind of let things happen and then have that learning and discussion in the debrief.
Thank you, Jennifer. And we don't interfere with the gameplay. In fact, we really try to step back out of it and let them apply their best thinking, just like in any other simulation that you might do. Let them do their best, and then the reflection and the debrief really drives home the points. So I'm going to show you this animated video about it, that you can see here that we can actually move points of interest around. And then you can actually look at your collaborators, and you can add other collaborators for your team. As you look at this, we really are looking at how do we want to get into different levels of depth and clarity. And there's several levels that we're going to show you here. The first is building capacity, and we're looking at breadth and connectivity. And understanding interdependencies looks at depth and clarity, and then discovering key insights like stability and focus and leveraging. So we put up all of our points of interest, and then we are able to identify them as either a key point. You'll see a star here on this bacterial infection, but we know that bacterial infections occur and medication errors can occur. We have to add medications to care for the patient, but we have to make a decision about if the medication errors occur, is it because we are adhering to medication protocols? And if not, then it can be a source of complications. So there's a lot of the infrastructure that's happening. We can make it a leverage point or a key point. We can say that we are, the same direction. Both of these are going in the same direction, or that they're going in opposite directions. And then we can highlight feedback loops so that we can look at different feedback loops that we've created as we're beginning to analyze more carefully about what has happened in this case. And it's been a wonderful way to really look at this in a broader sense about mapping the knowledge about what do we know about central line infections, what happened to Nora, and how we can actually prevent this from happening in a subsequent patient. So that gave you a quick overview, and there's much more to it than that, but I just wanted you to see that as an example. And so now I'm going to go back to my slide deck, I think. And ask for other questions as we're waiting on this other to show back up.
Carol, I just wanted to comment about causality and the idea around the systems thinking piece too. So Friday Night at the ER and causality are a nice kind of 1-2 punch, if you will, around teaching systems thinking. They have kind of different ways of doing it, but essentially you have the same result, and they complement each other nicely with having students really try to understand all the pieces of the puzzle, that come together around a patient care situation. So I just wanted to really emphasize the systems thinking piece and how both of these products complement each other and work well together.
Thank you. So you can see the Metalog slide now, Jennifer. Yeah.
Yes.
So again, this is a great product for causality and moving students forward, like Jennifer just illustrated. And then the last tool I want to make sure you're aware of is they actually have physical tools that are for team building and team collaboration. And there are a few here. There are videos and instructions for each one of these, but we just recently, right before the pandemic, purchased a few of these. And because they were in-person activities with lots of touching, in closeness, we were not able to deploy them, but we're looking forward to deploying them in the future. But you can see here, this is the Tower of Power. And this idea at the top is people having to work together to build this tower, communicate, collaborate, and really understand how that matters a lot in transferring that to healthcare in the way that we work. The bottom one is this balancing board, and the people who are blindfolded or being told by the other team members how to position the pieces. Then you get to understand better about how clear or not so clear your communications are. And so there's a variety of tools in this Metalog tools, and Breakthrough Learning is the US distributor for those at this point in time. So I thought you might be interested to know about those as well.
Carol, your screen is showing like your Zoom group too on top of your side. So I don't know if you just want a minute, there you go. Perfect.
Okay, thank you so much.
Yes.
But this is, maybe I can get, I thought I was showing the other slide. I'm going to try one more time.
So the question in the chat is, have you used the causality for a root cause analysis? And so we didn't I mean, you could take the Nora case and that's kind of what you're doing. We didn't necessarily call it a root cause analysis, but that is a really nice tool, I think, that you could use for RCA. Absolutely.
So Jennifer and I are so grateful for you joining us in this session, because we're so passionate about this training of our students to do systems thinking. And we find that this tool has been exceptionally helpful in doing that. And we wanted to share that with you. So if you have other questions or information, please ask us, because we just would love to share our excitement with you about that.
Thank you, Dr. Durham and Dr. Alderman. Great work.
You are welcome.
Thank you very much.
So the thing that has been most helpful for us is this opportunity to not just have students know, but have them do. And this tool allows them to do. And once we do, we learn from our mistakes, and that is what's really helpful. And we get to build their knowledge about systems, as well as their reflection on their own behavior about that.
Yeah.
The causality is just come out of its beta testing. So if you want to know more about that, if you go to Breakthrough Learning, and Jeff Hale is the contact person for that. And Mary, I'm happy to send you these slides for posting if you would like, or send them Karen and she can post them.
Sure. Yeah. And also, I don't know if this was worth to post. If you'd like us to post this, we can also post it,
Yeah.
you know, on a YouTube video. So people
That
have
may be the easiest way. People can see it in that slide deck then.
right. Yeah. Good.
It seems like this might be one helpful way as we move forward with the new essentials to address systems-based practice.
Right. Yeah.
Because it's hitting a lot of the competencies and the
That's-
sub-competencies.
Susie, thanks so much for bringing it back to the new competencies, because we're all going to be trying to figure out how are we going to do this. And this is a kind of built-in solution. I know that Friday Night the ER is a vendor exhibitor. So when you visit those, you can get more information. Jeff is actually in that booth. So when the QSEN exhibitor time occurs, you certainly can go there and find out more information. I love the fact also, as Gwen posted, that it can be used at varying education levels. I just wanted to add one more comment about that, because we have found, and Megan O'Connor was Gwen and I were on her thesis committee, and she actually wanted to look at this impact of this game. And I thought, well, I need to play the game to understand what we could help with her impact. And that was the first time I played it, was with her nurse managers. But she had actually, and others have played it with kids in the 6th grade as an example. And those students perform much better than anybody else, because they're not confounded by our supposed rules, right? And so they actually shared ideas across hospital or tables, and they actually talked about, went in and helped each other. And it was really a beautiful kind of thing to see them collaborating in an unfettered way. Somewhere along the line, we become siloed in our ability to collaborate.
Yeah.
So it was refreshing to think about 6th graders could outplay us in Friday Night the ER.
Even though it's our territory.
That's right.
We had a similar experience with interprofessionals, and we play with the business school, and oh my God, they're great players. They know teamwork. So,
Yes.
Yeah, and systems. So, well, thank you all. I'm going to run off to the 1 o'clock, but thanks so much. This was really great.
Thank you.
Thank
Thank
you.
you very much. Bye-bye.
Have a good day.